Hey everyone, and welcome to this explainer. Today, we are going on an absolutely fascinating journey tracking the evolution of healthcare technology. We're going to look at the massive transformation from giant, room-filling machines straight out of a classic sci-fi movie, all the way to the invisible, life-saving predictive data models that doctors are using right at the bedside today. It's a wild ride, so let's break it down.
Okay, let's dive into our roadmap for today. We've got 4 main stops. First up, from punch cards to clouds. Second, technology and patient safety. Third, decoding health data analytics. And finally, number 4, the new face of HIM.
All right, section 1, from punch cards to clouds. Seriously, when you look at this hardware evolution, it is truly marvelous how rapidly things changed.
Just think about it. Back in the 1960s, hospitals used these massive mainframe computers that literally filled entire rooms, and they ran so hot they required extreme cooling controls just to stop them from melting down. Then, by the 1970s, we got what they called dumb terminals, which were basically just keyboards and screens hooked up to a main server. The 1980s and 90s? That's when personal computers and local area networks, or LANs, hit the scene, which finally made sharing data between different hospital departments a reality. And today? Well, we've got comprehensive electronic health records stored securely in the cloud, and providers can access them on wireless devices right next to the patient.
To put that in perspective, imagine a time before keyboards and touchscreens were even a thing. Instead, people used punch cards. You would literally punch physical holes in a card, and those holes were the actual instructions telling those massive computers what to do. One single punched card might just tell the computer to update a patient's address or enter a birth date. Could you imagine trying to manage a whole hospital's data this way today? No way.
Thankfully, how we input information got a whole lot better, giving us the highly mobile point-of-care tech we use now. Which actually brings us to one of my absolute favorite terms in modern healthcare. If you're ever in a hospital and you hear doctors and nurses talking about a cow in the hallways, don't panic, they haven't started a farm. They're actually talking about a computer on wheels. It's essentially a wireless computer mounted on a rolling cart that goes directly from patient to patient, capturing critical vitals exactly when and where the care is actually happening.
Moving right along to section 2, technology and patient safety. Because, this evolution wasn't just about making things more convenient. It was desperately needed to save lives.
Here's a number that is going to stick with you. 98,000. Back in 1999, there was this groundbreaking report published called To Err is Human, and it revealed a somber truth, that up to 98,000 people were dying each year in hospitals from entirely preventable medical errors. It was a massive wake-up call for the industry to start leveraging technology for patient safety.
So how did the tech world respond? With some truly brilliant interventions. For example, today we use barcodes to verify a patient's identity before they get any medication. The systems also have built-in edits that physically block impossible data entry, like the computer simply will not let a pill be accidentally ordered as a liquid. We also rely on computerized provider order entry, or CPOE. This prompts physicians while they're typing to make absolutely sure that no critical piece of info, like the specific route of administration for a drug, is ever left off a prescription. And all of this safe, accurately entered data, it feeds directly into something called evidence-based medicine. So, the crucial point here is that by capturing these massive amounts of electronic data, doctors don't have to guess what works anymore. We can definitively prove which treatments yield the best outcomes by simply looking at the data from controlled, peer-reviewed biomedical studies. From there, hospitals formulate clinical pathways, which are basically step-by-step best practices for treating specific things, like a heart attack.
But here's the catch. You can have the absolute best data in the world, but if it's locked away in one single hospital, it doesn't do you any good when you visit a specialist across town, right? That's exactly why health information exchanges, or HIEs, are so vital. HIEs create interoperability. They securely link all these diverse facilities together, from your local cardiologist to a long-term care center, ensuring your critical patient data actually follows you no matter where you go for care.
Which perfectly cues up section 3, decoding health data analytics. Because now that we're safely storing and sharing all this health data, how do we actually decode it and make it useful?
Well, first, we really have to grasp the difference between raw data and meaningful information. Let's look at a textbook example. Take the raw fact, 33% of patients have insurance. Okay, that's data, but it's kind of just floating there without any context. But if you manipulate it to say 33% had commercial insurance in December, which is a 2% increase, boom, now you have context and that data becomes meaningful information.
Let's see how this builds into the 4 main pillars of data analytics. It's kind of like a timeline of understanding. First, you have descriptive analytics, which looks at the past to tell us exactly what happened. Then, diagnostic analytics digs a little deeper to tell us why it happened. Next up is predictive analytics, which uses all that historical data to forecast what will happen in the future. And finally, prescriptive analytics actually suggests possible courses of action, telling us what we should do about it.
And to pull all of this off, the healthcare industry relies on some seriously powerful tech tools. We use data mining to hunt down hidden patterns inside massive databases. We use dashboards to give hospital leaders real-time, high-level summaries of their strategy. And we use predictive modeling algorithms. So what's the big so what here? Well, by using these tools, hospitals can do incredible things, like accurately predicting how many inpatient beds they're going to need, forecasting readmission rates, and get this, even spotting communicable disease epidemics before they spread.
All right, moving into our final chapter, Section 4, the new face of HIM. How has this digital revolution actually changed the day-to-day lives of the people working in health information management?
Honestly, the transformation is night and day. Just compare step 1, the old days of slow, tedious paper pushing and handwritten record abstraction, to today. With steps 2 and 3, we have instant electronic health record capture. The information is managed in real time, which frees up professionals to focus on advanced data manipulation. It saves immense amounts of time and money, and most importantly, it improves the quality of patient care.
And because the physical paper is mostly gone, departmental structures have completely shifted. A lot of organizations now use a virtual HIM model. This means coders and analysts can work remotely, which frees up precious, expensive hospital space for things that actually generate revenue, like adding more operating rooms. On the flip side, some hospital systems use a centralized HIM model, where they combine staff from, say, 3 different hospitals into one single hub, entirely eliminating duplicate resources. Now, to be objective, these models definitely have their downsides too, like potential isolation for those remote workers, and of course increased cybersecurity risks when you're accessing sensitive data from afar.
But ultimately, this all means that the HIM profession has evolved into a highly specialized technology sector. These professionals are no longer just managing physical files, they are managing massive, complex ecosystems of data. And that has opened up incredibly fascinating new career paths. We're talking highly technical roles now, like data integrity analysts, mapping specialists, and experts in data governance and system implementation.
It has been an absolute whirlwind of a journey, from those old punched cards to today's predictive algorithms, and honestly, we're really only just getting started. As machine learning and health informatics keep advancing, the potential is pretty much limitless, which leaves us with one incredibly exciting, provocative thought to wrap up this explainer. If our data can already predict our healthcare needs today, what will it cure tomorrow? Thanks so much for learning with me today, and keep that curiosity alive.